Okay, I think I won't say it's coming to the end. I think it's coming to the beginning. Because we've learned so much from our speaker and we're beginning to think more and more. I think it's a beginning rather than an end, right? But I think it will never end, okay? Anyway, and we have, what I'm trying to do, Andy, we're trying to do is we have so many wonderful presentation and interaction from the floor. And probably we will just take out a few issue and then we saw some issue flash up during the day, and I'm not saying covering all of them. And then um, maybe any further thoughts about it. We hope to see how we could build on the existing platform for integration coordination, and how could we take this forward? How could we put it up, and then hopefully tie into the future workshop and later on some statement of tasks or things like that. Okay, I think we have been hearing a lot of good examples, all right, and excellent work of integration coordination. And many speakers share their experience and some of the case, wonderful work they've done in the different part of the world. And I think there's also very important point I think Jan brought up from the um, first thing in the morning. And while we're scaling up the integration coordination, we got to be more little bit cautious to not to have a detrimental effect on the individual life responsibility. And so I think we have to strike a balance, and we got to be cautious as we integrate, involving different sectors, make sure we don't make one sector disintegrate. I think we should move on, right? I'm not saying we don't move on, but I think we got to be aware, be sensitive of the possible other effect and try to minimize. And then it comes to the from leadership to the front line and talk about building up the capacity of workforce, and a lot of discussion about education and training, how to integrate and coordination different sectors, especially how to build up the workforce. I think that's an emerging issue, and perhaps the training we talk about, and not just leader and different levels. And in terms of engagement, apart from government, we talk about engagement, the civic society, and the family, the parents, the private sector, the large business, small business, NGO, and those are emerging issues that we do. And also thinking about supporting the families, about for young girls to be the future carer, and also the women, not just because in certain part of the world they are vulnerable, but also consider the multiple roles. It doesn't really matter whether it's a low income country, even high income country, especially lady have multiple roles. And also the issue of equity keep on coming up, all right, and then targeting those at risk with disability, immigrant, mainstream families, and then also in the last session we talked about should we do universal coverage or be more targeting, and I think I've said enough, and I'll ask Andy to anything to elaborate.
Well, thanks, Albert. I think obviously Albert captured most of the I think key points I think that I heard as well.
Sorry. There's one other important point we talk about. I think more worthwhile to more discussion is a community of health workers. Some presentation look at the sustainability issue and building the incentive and formal recognition. We talk about the legal recognition, and I think those need to be even further discussed, and to more kind of incentive and recognition of the community health worker. Otherwise, they could easily fall into the pieces. Sorry, Andy.
No. Actually, that's an excellent point. I mean, I think the one of the things that for me that was compelling was that talking about the identification of leadership at all level and providing the necessary support and training. I think from a more advocacy perspective, maybe that's one of the main challenges is who are these leaders and how do you identify them, and how do you then properly support them so that they can help you move the agenda forward. And the sense I have is that there may be opportunity beyond the traditional platforms of health, education, and social protection, and that maybe we need to look a little harder beyond. And certainly we hear in their various countries there are various structures and there are various other agencies that are trying to meet the needs of children. And so maybe that's another opportunity for us is to look for us to search a little harder and see there are other non-traditional channels in which you can advocate and help build a better agenda for our kids. And especially, I guess, reference to the first presentations, keynote presentations about where we talked about integration versus combination. If the idea is that trying to coordinate across different sector can help us reach our goals as well, maybe having more stakeholders that are willing to contribute and serve as a platform for the work will help us get there a little quicker. Comments from the floor, please.
Reluctant to ask yet another question. I think I would like to come back to the comment that was made about the table that we saw with the integration. I think it was Emily's table, and then John commented on it in terms of the American and European countries having very low levels of integration. And I was just wondering if anybody had any thoughts about the cultural aspects of that, and whether there is some cultural reason why possibly integration is not seen as being something that is being seen as something to do with the individual and the individual exercising a right to access things. That's all.
Of course, we also want to encourage comments from the webcast participants. So it sounds like it's been a long day, and I want to thank all of you for hanging in there and obviously contributing to this very enlightening and exciting discussion. And I think if there are no more comments and questions, Albert, I'd like to close the session at this point. And I want to thank all of you again for your participation and contribution. I think we all learned a lot from the past couple of days. And hopefully we'll be able to take the lessons forward and our work and we'll be more effective in the field to support our children. Thank you.